7 o'clock, or 5 o'clock. These are the best views for bringing to view a VSD. Cardiologists like it in a transverse position. Obstetricians like it in this position. I think if they are big VSDs, it doesn't matter. But most of the doctors and sonographers in my practice pick up VSDs because they've got the heart at 11 o'clock or they've got the heart at 2 o'clock. And then if you magnify your image, you then will appreciate your VSD. When you see the VSD, you need to look at red-blue flow. Is there equal volume of flow across? Because if the flow is only unidirectional, it's likely you're looking at an associated cardiac abnormality. 1 o'clock, the VSD. But I will not see this VSD if it's small in a transverse position. If it's a big VSD, it doesn't matter. In a transverse position, I will see it at any angle. And that's why cardiologists like it in this view. Well, at least postnatally, they like it in this view. For aberrant subclavian, you want to have it in a position where it's up at 11 o'clock. This is a baby with an aberrant right subclavian artery. Again, you want 11 o'clock or 2 o'clock, or at 5 o'clock, or at 7 o'clock. And then the best positions are looking at an aberrant subclavian. And the good news is, if the baby is not in a good position, don't worry. Because slow flow is beautiful technology that will show you the film of tiny vessels like an aberrant subclavian, and it doesn't matter what position the baby is in. It is a particularly powerful tool when you use it in the first trimester of pregnancy. This is the baby at 15 weeks. On power Doppler, we could not see it, but we turn on slow flow and straight away it becomes visible. Watch. Power Doppler, not visible. Turn on slow flow, immediately visible. It is a super technology, slow flow. We're looking for tiny vessels in the fetus. It is extremely important as we move into first trimester diagnosis and using this. This is a linear 9 probe, a transabdominal examination showing a 4-chamber, and then sweeping to a 3-vessel tracheal view to demonstrate an aberrant subclavian artery. And it is, again, technology which is useful in Vietnam because most women are so skinny. In Australia, there's less application. Last rule, priority. Priority is a ratio of the amount of color to the amount of grayscale. This is a very powerful tool. And you can change it. This is a baby who I saw recently, who was at 12 weeks. My sonographer knocked on my door and said, Simon, I think the baby has a VSD. When I look at this heart, I say there's so much color, I don't know if that's a VSD. Yes, I can see there is dropout in the heart, but I am not certain. So what do? I then turn around and I change my balance down to 50, not 250, I twist it down. And now I can see beautifully demonstrated that this baby has got a perimembranous ventricular receptor defect at 12 weeks. So remember, if you are using power Doppler or slow flow Doppler, remember balance and priority is a very, very powerful tool. And it's not just first trimester, this is second trimester, in a baby who had a previous total anomalous pulmonary venous return. This is with power Doppler, and as I turn down the balance, it gives precision and color imaging of the venous drainage of the baby's heart. And this heart as well, precision imaging with power Doppler and balance turned down. It is very powerful technology. This is a baby I saw a few days ago, and you look at a few weeks ago, the brain valley aneurysm, you can characterize by using slow flow Doppler with balance and see the movement and the fill, where blood goes and how it enters into the left ventricle, and why these babies have got a small left ventricle. It allows you to understand. So that's the cardiac handbook for those who have not seen it. These rules are all demonstrated in that LinkedIn. Tap on that LinkedIn, scroll down, and you can see all the pages of it. It's also available on the ISO website, and I hope you can make use of those resources. Thank you very much for your attention.